Thank you so much. First and foremost, I'm very thankful to the entire team, especially to my dear friend Mahoj Pahukar, who has given me this opportunity. So, to get on with the topic and to set the ball rolling, we are discussing today something of utmost importance because when the patient comes, our first interaction with the patient is in OPD. And as they say, the first impression is the last impression. I would say that first impression may not be the last impression, but it is still the lasting impression. So in this day and age, when quite a few of our patients come with a lot of preconceived notion and prejudices, and the internet and the Google doesn't helping matters, it is very important to interact with our patient in a nice way and to make them understand their problem in a very positive atmosphere. I have stressed the word positive atmosphere. Right. So going ahead. Yes. So OPD counseling is basically A, B, and C. A, of course, is the appearance and the dress code. B is our body language. If you look at the cartoon on the right, we can impress the patient with a lot of medical gobbledygook, but that doesn't really help. So if we talk of appearance, there's a picture on our left and there's another one on our right. On our left, what we can see are two of our harried colleagues, and that is the most common scenario in a populous country where the patient-doctor ratio is really very poor. And they, in spite of putting their best foot forward, they are not able to really be very positive. If we look on the right side, look at the picture of the face, a smiling face, a nicely combed hair, a good tie and a good dress with a good ambience. So that is the appearance of the OPD, which sets the ball rolling in a positive sort of manner. So appearance is of utmost importance. Body language. Now, body language, we can speak and communicate ourselves, but before we start speaking, the patient, any other person, looks at us, and what we say from our body, from our looks, from our hand, what we say matters a lot. Look at the picture on your left. There's a big line. People are disinterested. Many of the patients are looking at some other direction. The doctor is busy pouring into his book or his copy or his prescription. He may be very worried about the number of patients that he has to see. On the right, you can see a doctor with an open hand looking right into the eyes of the patient, smiling. So the body language on the right is what is desirable. So we have to strive for a body language which is positive, which is communicative, which shows the patient that yes, we care. Now coming to communication, these are a few things that I have noted down and I'll try to explain them one by one. The first thing is when the patient comes, he generally comes with a lot of anxiety and fear. We have to be positive. We have to put things in right perspective, and basically we have to allay the anxiety and fear. That doesn't mean that we have to paint a rosy picture, but we have to put things in a right perspective because the glass can be half empty. It can also be called half full. So our attitude should be half full rather than be half empty, and let the patient not become a nervous wreck. So a positive language, a positive body language, and a positive appearance adds to the effect of allaying the anxiety and the fear of the patient, and the patient may feel better. And a happy patient recovers well, we all know. Yes, listening is, as it is important to speak, similarly it is important, probably even more important, to be a good listener. So who is a good listener? Where the eyes are watching, you're all ears. You are giving the patient, you're turning towards the patient side, giving him your full attention. We are not endeavoring to say something, so our lips are closed, hand are still, so hand are not fidgeting, we are positive, we are all ears. So be a good listener, keep our feet silent, no foot tapping and anything of the sort, and be a good listener. And another thing, it is said that the most important sound to any person on earth is that of his name. So while interacting with a patient, it is good to be pleasant to the patient and call him or her by name. We have to put a little effort in looking up into the prescription and trying to remember a name. So whenever we speak to the person, we speak by name and thereby adding a personal touch. Yes, the other point that I feel is very important is be empathetic and not sympathetic. So what is the difference? Sympathetic is when you put yourself on a pedestal and say, okay, all right, we can understand you are in a problem. But being empathetic is feeling his fear, feeling his concern, and sharing his pain. So that is what the cartoon says, that we have to be empathetic, not sympathetic. Yes. And yes, patient may come and they may ask all kind of silly questions. So no question is silly in the OPD consultation. The patient may ask and pour his heart out, and in the process may ask something very silly as well. And we have to really be very, empathetic. That I said, we do not need to frown and not make fun in any sort of way. Other thing, we don't have to instill any kind of fear in patient's mind. You see, a problem when painted out of proportion will become very big, very problematic, like a life-threatening problem. It will become life-threatening problem. So we have to keep ourselves away from this tendency. And no, do not hurry. We can be quick, we can be efficient, but we need not be hurrying while seeing the patient. Other thing, we have to explain to the patient the treatment, but no need to overdo it. No need to put so many ifs and buts. No need to put so many rarest of rare complication. We have to be realistic, but let's not overdo it. And then, last but not the least, we have to give our patients some time, some space. They can go back. We do not have to sell our surgery. Like in a joint replacement surgery, we do not have to sell it. Let them earn it. Let them ask for it. We can suggest everything and give the patient time, a space, so that he can go and think over it, mull over it, and come back and ask for it. Yes, that is the stark reality of our country. It is overcrowded with patients. This picture I have taken from Times of India, where an IPD, an inpatient area patient is shown in what is the picture in most of the medical colleges in crowded areas. But still, we need to have a heart and be good to our patient and give them a very positive overall experience. Therefore, thank you so much. Have a great day, great week, month, and a wonderful 2021 ahead. Thank you so much. Thank you.